You know, after 20 years or more of cuts and frozen budgets under Conservative and Liberal governments, healthcare in this province is falling short of what families need and what families deserve, frankly. Wait times are far too long and our overcrowded hospitals are packed far beyond capacity, leaving patients to be cared for in hallways and in public spaces, places like lounges and TV rooms. I want Ontarians to know, and I want nurses to know, that they don't have to settle for that anymore. We can do much, much better. You know, nurses are at the heart of our healthcare system, and it's you that deserve to have a government that's going to give you the supports and the resources that you need to get your work done, and to know that you can do that work feeling that you're providing the very best care that you can possibly provide. So New Democrats will increase hospital funding immediately by 5.3%, with a new $1.2 billion investment, while we're also ensuring that annual funding keeps pace with inflation, population growth, and our aging population, and that we meet the unique challenges and needs of our very diverse communities. We're going to make sure that hospitals have the staff that they need to provide excellent patient care by stopping any further layoffs of nurses and other frontline healthcare workers, while we work with everyone, all stakeholders, all healthcare stakeholders and partners, to develop a comprehensive staffing plan for our province. We're going to put $19 billion over 10 years into hospital capital expansion to meet growing capacity needs. And we're going to create 2,000 new hospital beds right away. The other thing we're going to do is end arbitrary caps on surgeries to shorten those wait times. And we're going to make sure that every single Ontarian can get the care that they need when and where they need it. I know that nurses work in all kinds of different settings and all kinds of different parts of our community, and I'm going to talk a little bit more about that in the next question. An NDP government will launch the largest expansion of community-governed, not-for-profit healthcare that this province has ever seen. And we're going to do that because we fundamentally believe in that model. We will increase the base funding for community health centers by $30 million. And we're going to ensure that ongoing funding is available. So we're going to increase that funding every single year to meet inflation. We're also going to invest in new community-governed, not-for-profit health centers in 35 regions that currently need them. And those regions include underserviced GTA communities, places like Mississauga, like Brampton, York Region, Scarborough. And the NDP government will also establish a dedicated ministry for mental health and addictions. For far too long, mental health and addictions have been on the back burner, and we need the focus of a ministry to really start dealing with the problems that we have with mental health and addictions. We're going to hire 2,200 new mental health care workers, allowing 28,000 more Ontarians to access the services that they need every year. And we're also going to hire new mental health care workers to ensure that every high school has access to mental health supports. 400 new mental health workers will be hired for that reason. And you know what? The NDP will also declare a public health emergency when it comes to the opioid crisis, recognizing that there's a huge scope to this problem and that the seriousness of the crisis continues to worsen. Mobilizing resources across the province is what we need to do. We're going to focus most urgently on harm reduction to save lives now, and we're also going to expand the distribution of naloxone and other anti-overdose medications. We're going to be supporting the establishment and operation of supervised injection sites and overdose prevention sites wherever they're needed in our province. You know, we believe that listening to frontline harm reduction workers and people with lived experience is the important thing to do, because they're truly the experts and they're also the heroes who are saving lives today. My message here in 2018's National Nursing Week is simple, but it's heartfelt. One big thank you to nurses around our province. Thank you for your dedication, to your time, your passionate efforts, You actually change and save lives each and every day across our province. And on top of that, you're some of the fiercest advocates for public health care that anyone has ever seen. So, thank you. You know, I know it's hard to deliver world-class services and fight to fix our system, which is what you do, when nurses and healthcare workers are being stretched to the breaking point. You know, we all remember when the Conservatives were in office and they handed pink slips to 6,000 nurses. Kathleen, Wynne, and the Liberals have frozen hospital funding that's led to more than 1,600 nursing jobs being cut since 2015. You deserve so much better than that. We have to do much better. And so the NDP has a plan, and we're going to put a moratorium on layoffs for frontline healthcare workers, and we're going to work with partners and stakeholders to set the right staffing levels for our hospitals so that they can deliver, so that you can deliver the quality of care that you want to deliver to each and every patient. And we're going to work with healthcare partners to take action to stop the violence that healthcare workers are facing on the job. It is at epidemic proportions, and it has to stop. We're also going to pass legislation to extend presumptive coverage for PTSD to all frontline healthcare workers. You should never have been left out of that legislation. You shouldn't have to prove that your condition was caused by your work in our emergency departments or anywhere else. That's change for the better, for nurses and for all Ontarians.